My immediate associations are that it is a worldwide project which you can use to help women with endometriosis, and in which we are going to use big data. And I think it will help to improve the level of care and to improve the level of knowledge about endometriosis on a worldwide level. My biggest professional strengths are that I am working in a large universal hospital in which I can combine clinical work for women with endometriosis, both at surgical level and also at infertility level. And I can do research, clinical research and basic research. I have a large network of colleagues with whom I work effectively and in a respectful way. We know each other, we help each other, we do research together. And I have also a large network of patients who know where to find me. So I have the feeling that I'm in the middle of what's happening in the world of endometriosis, and I try to do my best to support young colleagues and to support students and to support also patients in order to gain knowledge and to improve the care. Well, I do not really know yet because it's very early in the process. But what I hope is that I can make a contribution to this worldwide network of experts and maybe in the future also patients who help each other, who communicate effectively with each other, and ultimately who can bring the level of care and research to a higher plan. What I also hope is that the female project can have an effective cooperation or integration in already existing societies, for example, because what I think we should not do is work against each other, but we should work together. There are many societies who are interested in endometriosis, and I think that's very good because the more people are working on endometriosis, the better it will be. But let's work together, and that's what I also hope for the female project. That because we are all the same people who are being part of different societies, and we are all hoping to be integrated in the female project as well. So I hope that we can work together and not against each other also in this project. What I think is that when there are plans that have to be implemented or that have to be maybe further developed, that I would like to be part of it, that I can comment on them and that I can work together in them. So I will not know everything, of course, and there are some parts that I have no knowledge of at all, and then of course I will tell that. But when you share your ideas, then I think the different advisors can decide, oh, this is something that I know a lot about, so let me help with that. And maybe other projects, we think, well, we don't know anything, please go to that person. So I would like to get plans on which I can comment on and in which I can help. Gender equality is a very, very important topic. We are, of course, always talking about women because women have endometriosis, but I know more and more it is important to say, for example, persons who have a uterus. And I think it is really important, just the fact that you are aware of it and that you have been thinking about how to call these persons. And I think that is so respectful that you do that, and it is so necessary because that's really what many persons with endometriosis feel. Well, maybe not many, but a substantial part feels like they need to be respected for that. And I think for us it is so easy to do that. So let's pay attention and let's choose our words as respectful as we can. And in my own system, I have the word woman always in front because I'm so used to that. But it is not meant to hurt anybody or to disrespect anybody. So I think we should pay attention to the wording and we should be respectful for all people with their opinions. So I think it should be high on the agenda. In my own hospital, I try to pay attention to hiring people from diverse backgrounds, male and females, non-binaries, transgender persons, homosexual persons, whatever. Of course, I will not ask about their background, but when it's obvious, I want to include them as much as possible. And we have a very diverse and inclusive team, on which I'm extremely proud. What we think is very important to have contact with, for example, the patient community. We have a very active patient support group in the Netherlands, and when we have important topics that we have discovered, or when there is a meeting that we can invite them for, we will do so. We have approximately one time a year a meeting, especially with the patient support group and our working group on endometriosis from our professional institute. So that's important. We keep them into contact. And as far as lack of awareness among other professionals is concerned, one of my main research interests is reducing the diagnostic delay in general practice. So we have a collaboration with the Department of General Practice from our university. It's the only one in our country, the only collaboration in our country in the field of endometriosis, and we are identifying factors which make that general practitioners need a long time to diagnose persons with endometriosis. And we have a PhD student on that who is very active. So I think we need other professionals to become aware of endometriosis, and we need to have good contact with the patient support groups in order to reach the broad public, not only the patients who we already know. Yeah, for me, that's really difficult to answer, because I have the feeling, but maybe that's a wrong feeling, but I have the feeling that we are in the process of starting now. So, well, for me, I'm just starting to become a part of female. So for me, that's very difficult to answer that question. I don't think I can. Yeah, I hope that it can build a large network, and for me also that I can enlarge my own network. And that we know from each other what our strengths are and what we can do in our own country or in our own community, and how we can cooperate better. Yeah, that's what I hope to gain. So cooperation on a global scale. I think there are three large problems. First is the lack of awareness. And one of the very important causes of that is that people present with many aspecific symptoms. So when they come to the GP does not immediately recognize the symptoms as possible endometriosis. So lack of awareness is an important one. The second one is related to that, is that the lack of a diagnostic test, because in the past we used to do a laparoscopy always in order to confirm the diagnosis. Now we are shifting towards a combination of physical examination, ultrasound, or MRI, and maybe we need a laparoscopy if the other ones were not successful in confirming the diagnosis. But it's all a little bit difficult. You need a gynecologist, you need sometimes an operation, you need an ultrasound or an MRI for that. So the lack of an easily accessible diagnostic test, for example, blood tests, is one of the big problems. And I know there has been done so much research about it, but we did not find it yet. And the third problem is that I think we need to understand that endometriosis is a chronic inflammatory disease. It's not that you diagnose the disease, you do an operation, and the patient is cured. It needs a lifelong treatment plan. And as long as we do not understand that, as long as we do not treat patients like that as physicians, we will not be able to really control the disease. Women will be disappointed because we do the operation, and after a few months or years, they will have pain again. And we did not warn them, and they will be disappointed and go for another surgery in another hospital or maybe to another country even. And if we would have warned them, this is a lifelong chronic disease and we have to treat you with medication, hormonal treatment for a period of time. Maybe we need some surgery somewhere on the way, and after the surgery you need medication again. And if we had warned them for that, they would better understand, they would be able to cope more effectively, more efficiently, and that would increase their quality of life. So we need to change that. So these are the three problems that I see as the largest problems in endometriosis. Oh, that's a very, very difficult question, because I already told you that I'm in favor for being inclusive and being diverse, and it seems almost like a contradictory that you then want to support only women's health. But unfortunately, it is necessary. But we know, because we know that women-specific diseases are not funded as much as male diseases. So it is necessary to fight for that, although it does not feel right. So if I had the political power, and I have tried to use my influence with our Ministry of Health, and it was only only partially successful, because we are at the table now, but we are not getting money yet. But I think it is really, really necessary to provide funding for non-mortal diseases, because cancer funding is relatively easy to get, being a researcher, and diseases that give a lack of quality of life are underfunded. And I did my inaugural speech a few weeks ago, and I have asked them to give attention to diseases who are not only decreasing the quantity of life, but in fact the quality of life. And in Dutch you can say that in a very nice way. In English it's a little bit more difficult, but that would be my call. Just so to have attention for quality of life, especially in this disease, because if you treat endometriosis effectively, the person with endometriosis is able to work, which is important for the economy. She will be able to take care for her family, which is important for also the males in our country, and it's also important for economy, and she will be happier. It will improve her quality of life. So there is so much to gain. And of course, if people are old and they are getting a malignancy, it's also improved to treat them well and maybe to prolong their life. But let's have attention for the quality of life in also the younger people, who will not die from endometriosis, but who will suffer from it. And then we should give attention in a way that it is clear that we are not only paying attention to women, but that it also has its beneficial effect to the whole of society when we treat this women-specific disease.